Slice of Pfeiffer Clinical Cuts. I'm Dr. Pfeiffer. I'm here with Taylar. We are going to go through the Leadership Diagnostic.
Yeah. First of all, you have to tell me what is a or the Leadership Diagnostic. I have no background or reference for that.
Ever. Yes, definitely not the papers that are in front of you.
No, pay any attention to these.
So the Leadership Diagnostic is
open book test.
Is 6 different types of leadership qualities that we see that contribute to toxic culture. And some of my experience, not only in the operating room, but experience dealing with medical leaders and medical leadership, is that we see these amplified in certain situations and amplified not only in the operating room, but outside the operating room. And they really contribute to a difficult culture for people to work in, which then really makes for a difficult culture for patients to have optimal outcomes. Mm-hmm. So the idea of this was not only to help us to identify them, to help us to, should say, number 1, to help us define them. Number 2, help us identify those tendencies in ourselves. 3, help us to not only to treat them if we're going to treat them, and then to help employees to see if you're stuck working under a toxic leader. What are some tools that you can use to try to move forward and improve your environment?
Very cool. So you mentioned that it's to help identify different types of toxic leaders. Have you got some kind of approach or maybe some way that we've figured out the different types?
Like an acronym or something?
No, that would be nice, though. Somebody really smart might come up with an acronym for them.
So good. Mm-hmm. That would be so good.
Yep. So in looking at the information you've given me to look over about toxic leadership and the leadership diagnostic that you've put together, the first one that I'm reading about is called the Tyrant.
Yes.
So a leadership profile known as the Tyrant or the Malignant Dictator. Can you talk with me about that?
So the Tyrant or the Malignant Dictator. So many people will find this is classic in the realm of surgeons, but these are folks who tend to have narcissistic tendencies. We see that quite a bit. They tend to use their team as tools. They view their team as a means to an end. They oftentimes will justify their bad behavior based on trying to be results-driven or safety-driven or something in those ranges, but in reality, they're undermining their own ability to participate and to lead because they're leading with fear. They lead by gaslighting. They lead by really creating an environment with the impression that if I make this painful, people will move faster and I will get to my goal faster, but ultimately they undermine their team. So some of the questions that I think we have for them to ask themselves is, do I do that, right? Do I view my team as tools, right? Do I have I ever had folks refuse to work in the operating room with me? Have I ever sent a nurse or someone or a subordinate home crying, right? Mm-hmm. So those types of that type of toxic leadership breaks down the environment, and it really causes an environment that's dangerous for patients because ultimately it compromises safety.
Mm-hmm. And then if you are someone who thinks you might be not the tyrant or not the malignant dictator yourself, but thinking that you may be employed or work under the direct supervision of somebody that fits that bill, that's using those tactics, using guilt, using you as a tool rather than seeing you as a whole person, minimizing, making you leave a shift just deflated, broken, sad, forgetting why we went into what we do. And you and I in medicine, we want to help patients. But that's a pretty strong, like self-driven calling. So to have somebody you work for that breaks you down so much that you lose sight of that, that's pretty bad. Is there any tools or maybe survival tips or guide mayhaps that you might come up with?
Perhaps a survival guide. So yeah, if you find yourself working in this environment, the key, number 1, you should be courageous. Number 2, you've got to watch out for yourself. And number 3, you've got to document, because one of the things that we find is, especially in this environment where fear and pain are the drivers of productivity, oftentimes, when a leader has been behaving badly, like if they've been screaming, yelling, raising their voice, using profanity, tearing people down, like they may even go out ahead of time and say, hey, you're going to hear about this. You're going to hear about this problem. It's like they're preemptively taking the control to undermine the system, essentially, to say, hey, Taylor's going to come out and tell you that I was a real jerk, but you know me, patient first. That's a pretty common one that we see. And I think that from the hard part is when you're not in the position of power, having the courage to document, because when it's not documented you lose your power and you lose your ability. So you not only have to have the courage to stand up for yourself, but you have to have the courage to document, hey, this is what this person is doing is wrong. This is how the incident happened. This is how it got documented. And ultimately, it may be painful in the moment for you to do it, but it will be better for not only you, but also for the leader and also for the future employees who work with that leader. I think finally, the one thing that we talked about or that I've seen is treatment options. Like, what are you supposed to do if you feel those tendencies? Because not all leaders are like 100% a tyrant, right? Mm-hmm. But there can be those moments. And I think that you have to start with humility. You have to start with being humble. You have to recognize that all of the activities that your team do that allow you to be successful, and really back into that and understand that there are 100 different steps that happen to make this work. Number two, you've got to recognize when you're having these issues. You've got to recognize that you're losing sight of these things, and you've got to recognize that your team has you got to put yourself in their shoes. You have to have some empathy, right? You have to say, one, these guys want this case to be successful. Number two, they've got families at home. Number three, they've got stresses that they're dealing with outside of this operating room or outside of this job that we're doing. And then finally, I think you have to move forward, recognizing a tendency to have that, and then try with everything you've got to understand that you're always trying to will the good of the patient and will the good of the team. Mm-hmm. And if you can do that, then that tendency to try to lead by fear, ultimately you'll have a better and more productive and more successful team when you lead from a place of humility, gratitude, humility and gratitude moving forward.
Very cool.
That's the Tyrant.
Yeah. Would you like to talk about maybe another one of the leadership profiles?
Sure. There's only 6, so we're 1 down, 5 to go.
Well, specifically, the one that I'm reading about, or was reading about next, was the pleaser, or what you've called the weak pulse.
Yeah.
Can you tell me more about what that looks like?
So the pleaser tends to be a person a pleaser is a leader who is well liked, but often not well respected. Right? They oftentimes will avoid conflict. They will move forward. They'll avoid difficult situations where people could have improved out of avoidance of pain. Right? So they want, when there are opportunities for improvement, opportunities for constructive criticism, they will move around those. And the hard part is you lose the trust of your team. Because when you have great people working with you and there were places where you could have gotten better, or you have team members who could get better, and as a leader, you avoid those situations, then you ultimately undermine your team. And then you lose the good people, because the good people say, hey, I want to be with a team that's going to thrive. And the folks who are willing to live in kind of a happy-go-lucky environment where nobody cares whether they know what they're doing or don't know what they're doing, that's who you end up working with. And it ultimately is a challenge for the patients, and it becomes an issue as you move forward. And so I think ultimately avoiding those situations, you've got to be able to identify that as a leader. When there are opportunities to move forward, to provide, to increase efficiency, to increase your fingers locking together.
No, what? You were on such a good train of thought.
I thought you were trying to send me a signal with your hands.
I was reading.
Oh, gotcha.
I wasn't looking at my hands. I was just reading.
What is Taylar doing?
I'm not giving you subliminal messages. But it's funny. It's the part that I was reading about is not that I've ever worked for somebody who may or may not at some point in his career been similar to a pleaser. But when it says...
I know a guy.
If your boss is a pleaser, force the decision. How many times in our working relationship have I forced your decision making?
It's true.
I mean, it's just a survival tactic you have to do.
It's one of those tendencies. But I think that ultimately, as a pleaser, you've got to be able to ask yourself, am I doing what's right, or am I avoiding these situations because I want to avoid pain and I want to avoid a difficult environment? And oftentimes you make the excuse for yourself, right? You make the excuse for your team. Like, I don't want to make them feel bad, right? And so you see that. I see that happen, and I think that that's key. If you work for somebody who's a pleaser, who is who when things go wrong, they don't take that step forward to initiate that constructive criticism or those opportunities for improvement or debrief at the end, even when it is a little bit uncomfortable. Then you have to force the decision. You have to step up, and you have to be courageous in those moments. I think it's the key. And I think that ultimately that's the reflection for the pleaser is to look back, and you've got to identify that. You've got to make sure that you've got to identify that that's a challenge for you, right? That you're conflict avoidant, that you don't want to fight in those scenarios. And then I think you have to make the decision to act again. You have to act in a way that's going to move things forward for your team. And that action is huge because it changes not only the moment for that team, for that moment, for that patient, but it changes it for every patient that comes in the future, because every time that you avoid getting better, that makes things worse for the patients in the future.
Yeah, and I like your tip for somebody who may work for one, the force the decision, right? You just have to. I mean, if you're working for somebody who is trying to make everybody happy, in our job, it's making the patients and making the staff, happy, and also practicing actual medicine that doesn't always take feelings into account. Forcing the decision and saying, well, these are the two choices we have. You have to make the call. This is my reasoning or my recommendation for, which side I would go on if I were you. And I really like that you wrote that. And also you wrote, without pressure, there is no diamond. We have that in the office. It says no pressure, no diamonds.
That is true. Without pressure, there are no diamonds. That is very true.
I like that.
All right. The next one, number 3.
All right. So the next leadership profile that you have talked about here that I was reading about was called the indecisive or the analytic paralytic. Can you talk to me more about what that looks like?
So yeah, this is like I said, not everybody is this. They don't live in this world all the time, but there are these moments, right, when the decision is difficult or when the decision in your mind is difficult, and the defense mechanism is to just get more data. If I can just get more data, then I can make an informed decision. But really, all that is a delay tactic, right? It's a delay tactic that ultimately can cost patients or clients. It can cost them lives, limbs. It can cost them their livelihoods. And so I think that's the indecisive sits and they keep gathering data and they keep gathering data. And then instead of making a decision, they're waiting for that next piece of data to give them their decision. And that's not ever going to come. And so I think that piece is the challenge. And so you find that, and it frustrates teams, it frustrates leaders, it frustrates clients, it frustrates patients, because you're just waiting for what's going to happen, and it's just, we'll just order another test, we'll just order this, and then once this comes back, then we'll know. So I think that the key from the key questions you've got to ask yourself is am I slow to make those decisions? Do I wait? Am I waiting for something to come to show me what I need to do, right? And I think the treatment path is to go in and to say to yourself, how is more data really going to help besides just delaying things, right? And so, so for that leader, really the key is you really need to set a deadline. You got to set a deadline for yourself to make a decision. So whether it's 5 minutes, 5 hours, 5 days, set a deadline to make the decision. Once you've set that deadline, then you really need to look and say, what value does any more testing provide? Does it really provide me any data? Is it going to change anything, right? If this patient's got a broken femur, is a CT scan going to make any difference? Nope. It's just going to mean that I start later and I don't have to make the decision to go to the operating room, right? That's a silly example because nobody would do that, but that would be a similar piece. And then I think you've got to move forward, and you really just have to act. You have to act, and then you have to respond to what you've done, right? Let your actions become those new data points, right? Let what you've done become the data you were waiting for, and then you'll be able to see, okay, I changed this happened, now I'll act again, and we keep moving, and we don't just keep waiting and gathering. The key, if you work for this type of leader, is that you've got to push to make the decision. You've got to push to make the decision.
Yeah, that's what I was writing on here was the survival guide for both. It's interesting on this one, the survival guide for both, whether it's you are the analytic paralytic or the indecisive, or you work for somebody who has those tendencies. Both of the treatment is the same for both. You treat both. It's like when somebody comes in with a communicable disease and you got it from other person, you just treat them both, right?
There you go. Set a deadline,
Yeah.
force a decision,
Yeah.
act on those decisions.
Yeah.
And I think that takes the indecisive tendency away.
Right. Which, good examples of that happen from time to time. Things like, look, we've been talking about doing this. We know that this is important. We're going to do it on this day.
Correct. We found it. I saw it in the ICU when I trained in the ICU, right? The one thing that you could do as a resident that would get you in the most hot water was nothing. If you sit and do nothing and you wait for something else, or you're doing something like if somebody's heart rate is here and their blood pressure is here and the ventilator settings are here and their oxygenation settings are here, and your response was, we'll just watch and see we'll gather more data, right? That was the one way as a resident that we could always get dinged, because I'm just going to gather more data for 30 more minutes. Well, the reality is nothing's really going to change in the next 30 minutes. Everything that you're treating them with is exactly the same. They're going to be in the same spot or worse. Do something, right? And then when we would do something, if they got better, great, we could do something else. If they got worse, then well, that was not the right thing to do. I need to do more, or I need to alter. But you could use those data points, and that was the key. Action was a key for the indecisive. Action is what you have to do.
Well, and we hear that with patients and their families all the time. Nothing's being done. And that's the point of frustration almost for a lot of people, is like the person comes in every day and just says they're there, and there's no changes or treatments made, even though the patient's prognosis at this point hasn't changed at all.
Absolutely. Cool. Next up.
All right.
Number 4.
The number 4 on your leadership diagnostic profiles you have listed as the unprepared, or the incompetent relier.
Yeah. So the unprepared or the incompetent relier. So you've seen these, I'm sure, in the operating room with folks in your career. I've seen them. I've been there when I was as a resident. But these tend to be folks who go into a surgery, or they go into approaching a problem, and they're not ready. They don't know. They don't know what their schedule is. They don't know what they're doing. They don't know what is happening in the next case, and they tend to rely on their team members completely, oftentimes completely. So in orthopedics, that may be the reps that are in the room, the scrub tech who's there, the first assistant who's there, asking, does the PA agree? Right? Right?
I like that example.
Yes. What do we, what's the next step? What's the next step? What's the next step? And so those, they tend to be not only unprepared because they don't know where they're going, but they haven't anticipated the problems that are ahead either. So not only are they missing plans A, B, and C, they're just missing even, frankly, plan A, and they're relying on other people to bring that plan for them. And so I think that unprepared, it's a huge challenge. And I think equipment reps, especially in orthopedics, will see that when people turn to them and say, hey, what's the next step? What's the next step? And you ultimately deflate all the confidence in the room when everybody realizes, like, okay, this doc doesn't know what they're doing, right? And that is a huge, huge challenge. And so I think it takes a lot of you have to look introspectively at yourself to see, am I prepared? Am I ready? Right. And I think ultimately you have to set aside time for that. You always have to be developing your skill, but you also have to set aside the time, right? Whether it's, I'm going to do my preoperative reviews. I'm not doing preoperative reviews with the team 5 minutes before we start a case. We're going to prepare the day before, or prepare in the week ahead, or we have a set date that we review the cases that are coming, or that we're going to review this problem, because we're not going to have, I'm not going to go in and rely on somebody else. Because ultimately what happens is eventually you run into a point where their fund of knowledge is completely gone, and and as a leader, you realize your fund of knowledge isn't there either. And now you're totally lost. So, I think the treatment plan there is to not only schedule that you're going to be ahead, focus and commit to advancing your skills, and then creating things like cheat sheets, creating things that are gap coverers, right? So that you can bridge the gap. I guess I should call it a gap bridger. You can bridge the gap of where your knowledge is short, whether that's going to be coming from, hey, just a reminder, this step is a step that I always forget, right? Or this is a piece that I always get hung up on. And then you can have your team ready when those things come. And it's not that you don't know what's happening. It's just that now you have the team all focused and moving where they need to be. And then I think if you work under, if your leader is this person, is the unprepared, or the relier, right? Then the reality is that you've got to start making the cheat sheets. And you've got to initiate the conversations to make sure, because ultimately, whether it's a patient on the table or whether it's a business, a negotiation in a room, right? Ultimately, you have to, you got to do what's best for the patient. And what's best is not to be in with everybody looking around wondering what the heck's going to happen. So,
well, in our role, I've seen a lot of like circulating nurses, scrub techs that have figured this out, right? And they make their cheat sheets and they make their notes. So that way, when you come in and go, what is this tool that I've never used before? Somebody who's worked with you before and had that, they know, they've written it down. And that's the people who they're not doing that because you're the incompetent relier. They're doing that because they're used to working with people, some surgeons who are like that, right? Where they have to write everything down because he's going to ask for a hemostat, but what he actually wants is a tonsil.
right.
Right? Like, and when they know that, and when you hand them the hemostat and they go, this isn't what I want, right? And then they're flustered because it's not the instrument they actually want. These people, these really talented colleagues, they give them the right thing. So those are people who are used to working underneath somebody who's the incompetent relier.
Yes.
All right. Ready for number 5?
Number 5. I'm ready.
Okay. So the next one you have listed in your leadership profiles here that we're talking about is the flustered or systemic failure. Ooh, that sounds ominous.
Yeah, very ominous. So the flustered is pretty classic, right? These are the people who lose control. They lose control, and as they lose control, the system does fail, right? So when challenges happen or when things don't go the way that they're anticipating, when plan A is not happening, there's not a plan B or a plan C ready for them, right? They don't have that ready. And so what they do is they elevate the volume. They elevate their sort of not both verbal and nonverbal cues, which indicate to the rest of the team that we've lost control. Right? Control is escaping us. And what ends up happening is the louder you get, the more frustrated you get, the more flustered you get, the more your team backs away because they want to get safe. And what they need to do is be moving forward. And they need to be moving in to help you. But if you're flustered and you can't get through that, then you've got to have a way that you can work your way out of it. And so I think that the keys, one, if you find yourself in those situations, if you find yourself losing the ability to communicate, then you've got to be able to have enough insight into your own issues that hey, this is happening and the team is falling apart and we're having these issues. Hopefully in a debriefing, people would recognize that if you're running into these major hurdles during a case. But the treatment is really to stop, step back, look at your hands and reorient yourself, right? Take a breath. When you lower your voice, when you slow down and things get slower instead of getting faster and more frantic, the team is going to move in to help you. They're going to move in. They're going to rally around you. They're going to get to a different spot and they're going to try to help, right? You're going to see their team members are going to come in and they're going to start saying, well, what if we tried this? What if we tried this? If it's bleeding, all of a sudden you're going to have all the things that you need to help control the bleed and you're not going to have to say anything, right? But if you're attacking or crying out as the flustered leader, then everyone's going to back away and you're going to ultimately be alone. Yeah. So, and then I think the key if you're working for somebody who's flustered is trying to reestablish that environment, right? Trying to reestablish the environment, to calm things back down, to try to move in, even when it's uncomfortable to move in and help. I think that's the key if you're in that moment, and then helping somebody, whether it's just through a verbal cue, through a hand on the arm, whatever it may be, to try to reorient themselves. That can be the key. Mm-hmm.
Yeah. I like your self-diagnostics here too. When a problem arises, do I react with an emotional outburst? Right. Yeah, and I think if there's a problem that arises, whether it's in a case, a meeting or whatever, if your tendency is to just, combust, that's not helpful for you in the moment, nor is it helpful for anybody around you. If you identify that you're that kind of leadership profile, then finding an outlet, right, to take that, right? You can be frustrated that a case didn't go as perfectly as you wanted, but in the moment you have to put that on the back burner and say, I can deal with that frustration later, and then you have your outlet, right?
Right.
Whatever your healthy coping mechanism is, whether it's F45, right? Exercise. Or whatever it is. Yeah.
Hopefully
I like
not
that.
eating. Very good.
All right.
Last but not least.
The last leadership profile we wanted to discuss today was the distracted or the do it all.
The do it all or distracted, right? This is the also kind of falls into the micromanager, right? This is the person who struggles to delegate anything. They typically believe that they do it better than anybody else. So why have somebody else schedule my case? If I could do it, I can do it, and I'll get it done the way I want it. Nobody else will get it done that way. And so you tend to ultimately you lose your team because they don't have any responsibilities. And every time that they try to do something, you're over their shoulder, right? You're over their shoulders trying to give them advice about X, Y, or Z. And they're feeling, your thumb essentially on top of them trying to do their job when they're perfectly capable of doing their job and perfectly capable of doing the things that you should be delegating to them anyway. And so I think that is really ultimately what ends up happening for this person. The real pathology is an avoidance of making the highest level decisions, right? You whether you know it or not, what you should be doing is making high level leadership decisions that are driving things forward, that are driving your entire process. Whether you're in a business, whether you're in the operating room, you should be making those high level decisions, but you're avoiding making the high level decisions by making a bunch of low level decisions and trying to say, I'm so busy. I'm so busy. And then that way the highest level leadership choices are getting pushed to the back burner, which is just a way to avoid them. And so I think that as that leader, you've got to look to yourself and say, hey, is this what I'm doing? Am I micromanaging, or am I willing to delegate? Do I trust my team, or do I believe that I'm the only one who can do this? Right. And I think from my standpoint, that's the key, is to be able to delegate. The real treatment is to not only recognize you're doing it, but number two, trust yourself to delegate and trust the team that you're delegating to. Then figure out what's going to make you the most comfortable as you move forward, and then move forward and free yourself up to make the high level decisions so that you can make the high level decision you're supposed to make as a leader. And I think if you work for the micromanager here, really the reality is, start identifying the things that you can do, identify them on your own, act courageously in the moment and say, hey, let me take this on. Let me do this. Let me do this. Let me do this. I enjoy doing that. You are not good at doing this. Let me do this. And I think the more of those responsibilities you can take from there, it will make your job, if you work for this person, it will make your job more fulfilling, because you're going to be contributing in an immense way towards moving the team forward. You'll be doing something that probably you do better than they do, in all likelihood, I think, and then you move forward from there.
Yeah, I've definitely worked underneath somebody before who had a hard time with that part. And I remember having to ask him one day, I said, look, I've been, doing this a while. I have a lot of skill in this department. And let's say one of the things was closing the case, like being the closer, like letting him leave to go do something else that was more valuable with his time than closing the skin. I'm a certified physician assistant and have been working in the operating room a long time. I'm happy to do that. Would you like to watch me close a few times to feel comfortable with how I do it? And then from there on out, you can then just leave and let me do this.
Sure.
Because that gives him, 20 to 30 minutes back of his time if I'm doing that part while, he's off taking care of other things that a busy surgeon needs to work for. And so I've found that just vocalizing, like, I feel really comfortable and confident doing this.
Right.
What is our timeline? What does it look like to you to let me start taking that on and taking that off your plate?
And ultimately, that's a gift to the leader, right? It frees up their time. It frees them up to do other things. And in all likelihood, a lot of those activities, whether it's, in business, it may be scheduling, it may be setting meetings, it may be time management things, it may be, everybody has their strengths and has their weaknesses. And as a leader, if you believe that you're the strongest at doing everything, then you're definitely wrong.
Yep. You're not going to be able to balance it all.
Yep. So
cool.
That's it. All right. That's all of the leadership diagnostics. There's a thing at the end. What do we have there? Just a questionnaire, right?
It's just a question.
It's just allowing you. I mean, I think the challenge, maybe even they might call it a call to action. But if you look at those different 6 types, do you have any tendencies that are there? Do you have one that is your major tendency, right?
Mm-hmm. Clearly, a lot of these
indecisive,
overlap.
right? I'm an indecisive, or I'm a pleaser, or you know what? The reality is I'm a tyrant. Nobody wants to work with me.
Yeah.
Right? There's a million of those different options that are there. So number one, do you have the courage as a leader to own it and to go figure out what it is, then to treat it, and then to move forward? And if you live in that world and you're working in that world, understand the longer that you tolerate and don't act to try to improve your environment, to try to help your leaders understand where they are, the longer that you live in that same environment, which is difficult. And they're all difficult, right? Even though the pleaser may be a very pleasant environment, ultimately doing less cases with less efficiency and serving less people is not generally what high achievers want to do, right? Doing lots of cases, maybe with lower results, but super fast is what the tyrant's going to push you for, right?
Yeah, and both of those are going to result in subpar outcomes, right?
Correct.
You got the tyrant who's pushing and doing a bunch of cases as quickly as he can or as she can and at the cost of quality. But you've also got the pleaser who's doing less cases than they should be doing at a slower pace and not as efficiently and afraid to bring up when things didn't go the way they want. So they use something that they didn't want, and then you have a subpar outcome that way, for sure. I'm also seeing how a lot of these come together. I've definitely worked for somebody who I would say falls under the indecisive and the distracted. Has those two overlapping where I want all this data, and because I can't trust that I know everything, I can't trust that you might know how to do something, so I better do it, right? So definitely can see where some of these may blur together, in which case you're going to have a mixed picture on how to treat it, in the same way that sometimes pathologies can overlap, right?
Very true.
Right?
Very, very true. Yeah. And all of them just opportunities really in my mind to make the environments, the leadership environments, work environments, whether it's in the operating room, whether it's in the boardroom, if you can identify that you've got toxic leadership tendencies or that you're in a toxic leadership environment, then you can just make the environment better. And if as a group we can keep getting better, then we can do that in not just my OR, we can do it in other operating rooms, we can do it for other businesses, and ultimately we can make life better for everybody. And that's the key in my mind, is we can keep helping people get better. All good.
Nice work, JP.
Nice work, Taylar. Since I gave you the completely unprepared relier.
And again, those two can overlap. We find the root cause, though, right?
Right.
If somebody's shoulder's hurting and they're having cervical radiculopathy, you treat the major one first and hope the other one goes away. If not, then you get to that root cause later.
And you can do it.
Root cause, haha, no pun intended. Cervical root. Cervical spine.
That was hilarious.
I knew you were going to hit the wrong button.
There it was.